Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Jean Gresh, compounding pharmacist, and Nicholas Palermo, DO, family physician from Vernon, Connecticut, have created an educational program to educate physicians about the evidence-based benefits of LDN. They are currently following approximately 300 patients with various complex diagnoses. For information, please contact manager@pioneerhealthcenter.com or call Pioneer Health Compounding Pharmacy on 860-979-0089. Thank you for joining us today. I'm very pleased we have not just one, but we have two guests. We have Dr. Nicholas Palermo, who's a DO from Connecticut, and we also have pharmacist Eugene Gresh. We call him Gene. Thank you for joining us today, both of you.
Thank you. Thank you.
So, who would like to go first? When did you first hear about LDN?
Well, this is Gene. I am a compounding pharmacist, and so I have been aware of LDN for many years. We've been asked to compound it occasionally over the past 20 years. But I really became familiar with it about 3 years ago. Mm-hmm. And I discovered that LDN was something I didn't know enough about. And we had some pretty amazing success with a number of patients. And I came across a number of studies, and I was excited because now we had some evidence that supported a lot of the anecdotal evidence that we had seen over the years. And so I really started studying it, I would say, about 2.5 to 3 years ago.
Mm-hmm. What about you, Nicholas?
Well, for me, it was very interesting. I was at my dentist's office, and the receptionist was telling me that she had Hashimoto's disease and had gone to a local physician in Northampton, Massachusetts, and said that he had put her on something called naltrexone at a very small dose, and it had basically reversed her Hashimoto's, and she had never felt better in her life. And it turned out to be low-dose naltrexone. And as a matter of fact, she was doing so well that they didn't have to increase her from the 1.5 milligrams. And I worked with Gene quite a bit because I've learned over the last 15 years that alternative, complementary medicine, whatever we want to call it, functional medicine, that there are so many other things that we can do to help our patients. And I checked with Gene, and Gene was then telling me about what he had been doing with low-dose naltrexone. And then I started my own investigations on LDN. So that's how it actually started for me, by going to my dentist's office and the receptionist having been placed on LDN.
Mm-hmm. Amazing. So in that time, how many patients would you say that you have treated with LDN since then?
Well, for me, myself, because right now I am semi-retired and I primarily do consults, I probably have about 30 patients right now on LDN. Mm-hmm. And they have been varied, all sorts of different symptoms and illnesses, from Hashimoto's to colitis to rheumatoid arthritis, polymyalgia rheumatica, significant results with multiple sclerosis, Parkinson's, Alzheimer's, depression, various cancer patients. And the neat thing about LDN for me is many of my patients come back and they have very little side effects. Some have had some vivid dreams. Others, a few of them have had an upset stomach that lasted only a few days. Yet many of them are coming back with saying that their overall state of well-being has definitely been better. And as a matter of fact, so has their libido. Mm-hmm. The one thing that I've in the last several years is that that certain patients need to stay on LDN for an extended period of time. Some of my patients have seen results within the first 1 to 2 months. Others, especially MS patients, have taken anywhere from 6 to 12 months. So what I stress now is go low and go slow. That's why I use the protocol of 1.5 milligrams for 2 weeks and then see how they do, 3 milligrams, then 4.5 milligrams. There have been a few of my patients that haven't done well at nighttime, and I've actually switched them to the daytime, and that seems to have worked really well. And these are the same patients, believe it or not, for me, that have had the opposite effect with Benadryl, where normally most of us with Benadryl make us tired, yet these patients, it wires them. And I found many of these patients have done much better on the daytime dose. So these are the experiences I was thinking about that have been successful. I've been amazed at certain patients with severe depression that have responded dramatically well, and also with patients that have had all forms of arthritis. I guess that's it in a nutshell.
Well, you're absolutely right, starting low and increasing gradually. When I first started LDN, the norm was to start on 3 milligrams and then after a month move up to 4.5, but the dropout rate was really high. Obviously, I was okay. It didn't affect me. It worked really, really well. But people who are ultra sensitive to many drugs, especially the people with, let's say, fibromyalgia, ME, really do need to start low and slow. And that way we're finding, the dropout rate is very, very low.
And as a matter of fact, in that same light, many of my patients who have these multiple sensitivities, whatever they may be, as well as multiple allergies, I will start off, even at 0.5.
Mm-hmm.
I've
Yes.
been long enough to know that you start lower. So I totally agree with you that you need to look at your patient. And what I've also found is that many of them have genetic snippets that are related, especially MTHFR, MAO, COMAT in particular. And for whatever reason, I'm certainly not a genetic specialist, but they seem to have a different sensitivity as well. And if I know that, then I will also go lower.
Mm-hmm. And I have found people who have chronic fatigue as a symptom, by taking the LDN in the morning, exactly what you were saying is they find they have more energy throughout the day, where if they take it at night, they feel they've lost that buzz that they get through taking it in the morning. So there are many people who choose to take it in the morning purely for that reason. They feel as though they have more energy.
Absolutely. And being fortunate enough to be a family physician to look at the whole mind, body, spirit aspect, those with chronic fatigue and fibromyalgia, I've definitely found to have mitochondrial dysfunction. So I will use some of Dr. Sinatra's and Dr. Tettelbaum's formula to help enhance mitochondrial functioning. And I have found that in concert with LDN, it makes a huge difference. And then I also work with them, and I would probably say 60 to 80% of my patients with CFS or fibromyalgia, that they have various needs that have not been met from whatever reason. And I can go into those things, but briefly, whether it's an emotional need or a day-to-day need, once that's met, the success that I've had, or let me say that the patient has had, has also doubled and sometimes quadrupled. So that's why LDN is such a tremendous adjunct for a physician who is a functionally oriented, can understand what we have here.
Mm-hmm.
It's actually phenomenal.
And this question's for Jean. So what do you compound LDN? Do you do capsules, sublingual, liquid, cream?
So we primarily do capsules.
Uh-huh.
But we've done LDN in liquid. We've done LDN in transdermal creams. We have done what I would say are very low dose naltrexone and even ultra low dose naltrexone, which is very interesting in some of the patients that we have actually gone to the very low doses and still seeing some amazing results.
Yes, it's important to remember, isn't it, that everybody is an individual, every condition is individual to that individual, and nobody is the same. So what is a fit for one person isn't necessarily the right fit for another.
Exactly.
And fillers, what filler do you generally use?
We use Avicel. In the literature, it seems to be that is the standard that most compounding pharmacists are using is the Avicel. We have seen some other fillers being used, but we pretty much stay with the Avicel. We've had very, very good success with that, and again, it seemed to, from my research, has been the standard.
Would you say many of your patients use other supplements alongside of LDN, or do they primarily get the LDN from you?
Yes. So what I find, just like in functional medicine, when we actually help the patient with various aspects of health, LDN becomes a very, very important tool, but it's often just a tool that we can actually find other ways to help patients. And again, when we look at, I think what Dr. Palermo just shared about some of his other things that he adds to the therapy, whether it be mitochondrial support, fish oil, multivitamins, identifying toxins and removing them from our patient's environment. There's a whole host of things that we can do in addition to the LDN that really support a patient and the uniqueness of the patient.
I mean, there are some people that think LDN is a magic pill that you can continue, I know, to live the lifestyle that you're already leading, probably eating the wrong foods, not having the right supplements and the support. I mean, LDN isn't a standalone treatment, is it? If you want it to work and work most effectively for you, you've got to look at other aspects of your well-being as well.
That's absolutely true, Linda. And a couple of things that Gina and I work on. We have an acronym called BG Shine. And B, we look at, we not only do we look at their blood aspects, we look at their breathing. How are they breathing? And then G is we look at their gut. We know today the microbiome and how important that is. S is their sleeping patterns. H is their hormones. I is infection and inflammation. And of course, we know that inflammation, the anti-inflammatory aspect of LDN, is one of the greatest aspects that it has. We do look at their nutrition. We look at their exercise and play. We also know that most of our patients, especially I can tell you, I've worked with hundreds of chronic fatigue and fibromyalgia patients. Sometimes they're just not getting enough fun in their life, enough joy. And then E is, besides exercise, is the emotional aspect. And then D is detoxification. So there's more to that acronym, but Gene and I look at each of those things when we're looking at patients, and we do collaborate because of how our minds work. The one other thing, Linda, I wanted to tell you about tablets versus capsules and stuff is I encourage my patients, whoever they go to and their compounding pharmacist, to make sure that their capsules and pills have been tested to make sure that what's in them is the percentage that we need. Unfortunately, there has been a couple of circumstances where patients have received tablets and they really didn't have everything in there that we wanted to have as far as the percentage of LDN. So I know that many of us are still experimenting with how we get them into the different forms to assure that accuracy, but I hope that each compounding pharmacy would be doing appropriate testing.
Exactly. It's very important to make sure that you are taking the correct dose, and as a charity, we, even if the doctor is prescribing 50 milligram tablets to a patient and saying that they can dilute it themselves, it's not something that we recommend or promote at all. It really should be compounded correctly by a reputable compounding pharmacy.
Yeah, without question. And unfortunately, many of my colleagues who don't take the time to do the research might just do that. Say, well, just here's a 50 milligram capsule, open it up and divide it up or do whatever. And of course, we know that doesn't work. And as a matter of fact, it can be harmful.
That's what I was going to say. I have been told by a pharmacist that if you made up the LDN yourself, you'd have to treat it as fresh milk. You could be getting bacteria in it every time you open it or stick something in it to draw it out. It, to me, doesn't seem a very safe way of doing it.
Right. And it also really isn't scientific, because we know, it's like any other drug, even though this is off-label, that we want standard dosages, and we want to know if it works or doesn't work, and if it doesn't work, why. I will tell you that most of my patients that they said it hasn't worked was, number one, they weren't consistent, and number two, they didn't give it enough time. Mm-hmm. Those were the two main reasons. A couple of them said that, I had the side effect and I was concerned. And then I said, well, how long did you give it? And they said, after 1 or 2 days I stopped, rather than, just like any other drug that can be prescribed, there can be certain side effects. But were they too much to overcome? And I can tell you that a majority of the time it was not. Mm. So a lot of these different things, and that's why education is the most important thing, I think, along with the science.
Yes. I've had people contact me saying, that they were disappointed the LDN hasn't worked, and they've been on it for a month. Some people,
right.
It's even less than that, but I was just thinking of a case the other week. This lady had some liquid LDN, and it was a month's supply, and she'd finished the month, and it hadn't reversed all her symptoms, and it was obviously not going to work for her. When we did a survey a few years back now, it was quite interesting. Most people noticed LDN had done something for them around the 4-month mark. But for some reason, and this was really bizarre, some people had been taking it for a year and hadn't. I mean, if you've got a progressive disease, if for a year you have stabilised that disease, to me,
that's right.
It's working. Because, to halt a progressive disease. Anyway, they would seem to have halted their progressions, but haven't had any symptom relief whatsoever. It's been exactly the same, which was very disappointing for them. But this was only a minority of people. But then after 18 months of being stable, the symptoms started to recede.
Yes.
Why?
Yes. There was a great video, and I don't remember where I saw it, but one of my friends who I actually put on LDN, by the way, I take LDN myself, sent it to me from Norway, where the Norwegian doctor, even though it was socialized and they weren't authorized, it was prescribing LDN. And what you just said was exactly true. And this was in MS patients in particular again. But after the 12-month period, things started to change. When they went off of it, they said they didn't realize that their MS had stabilized. And when they went off of it, it regressed. Mm-hmm. When they went back on it, the progress. When they went back on it, it reversed it again. I think that's because the human being is so different, whether it's the organic acid, whether it's the genetic profile. I don't know if it really makes that much difference as to the why. I'm sure scientists will figure out at some point. Yet, that's why I tell my patients, please, at least 6 to 12 months as a minimum before you let go of it. I have a very dear friend in New Hampshire who I told about that was having progressive MS, and she just sent me a beautiful Christmas card saying, I'm 60% better. Wow. That's the kind of thing that's so rewarding to us. Mm-hmm. The other reason why I think education is so important, though, is that many physicians are just prescribing LDN, again, without looking at the whole picture. And I really believe we need to look at the whole picture. As an example, every patient that I've placed on with colitis, if they haven't gone on a gluten-free and casein-free, i.e. milk and dairy-free diet, doesn't do as well. If they are on a gluten-free and a casein-free, they do so much better. And as a matter of fact, many of them come back and say after they've had their colonoscopy that they've been cured. So again, I want to stress to our audience that we want to look at mind, body, spirit, and treat the patient as a whole. And obviously, we're looking at root causes.
Definitely. What advice do you give, Jean, to your patients?
Well, I ditto what Dr. Palermo just shared. What we have found is LDN is an amazing tool. And our bodies are amazing as well. When we actually look, and again, in functional medicine, what I love about functional medicine is we're trained to look for the cause, not just treat a symptom or a condition or a disease, but identify the things that we're bringing to our body that are actually harming our body, whether it be food or a toxin. And we also want to look at, are we giving the body the appropriate nutrients? When we talk about mitochondrial support, a lot of that is nutrient-based. But, our bodies function on nutrition. And it's, oftentimes we get caught up with the food being related to calories. But the quality of our food is really the nutritional value that supports our body's function. And so we do a lot of work with patients to actually identify these things and then make the necessary changes in their lifestyle to help support their bodies. And the LDN, as I said, was, one of the reasons that we are just so excited about it is because that tool is amazing. It is invaluable in our patients. When it works, it's a game changer for patients. And again, I spent many years in conventional pharmacy practice. We're not seeing the type of results in conventional practice that we're seeing when we actually use a comprehensive functional medicine approach along with some of these very progressive tools like LDN. The results are just amazing. And so we feel it's important that we want to educate patients, but also educate the physician population, because this is off-label. This is not, there's not a drug company out there educating physicians that are going to, benefit from this. And so one of our goals is to really get out there and provide the evidence to the practitioners to allow them to help more patients.
You have made me smile, but just at the end of last year, I had an email from a doctor who said to me he'd heard a lot about LDN. He was very impressed. And would I send a drug rep round with some samples? That did make me smile. Yeah.
Yes.
Getting back to, people think you make lots of money out of LDN. Who's making the money out of LDN? It's certainly not the LDN Research Trust. Yeah.
Right.
But education is definitely the key. And I know that you're going to be big advocates of the LDN app. So I'm hoping that will be such a great monitoring tool for you and your patients and the doctors that you will be educating. But education is key, and I've had this with other pharmacists where they feel that the education has got to come from the pharmacists to educate the doctors, because the doctors are very stretched time-wise, and some of them just want all the information given to them on a plate. They haven't got the time to do their own research. So having somebody to educate them in the way in which you're both doing, I think is phenomenal. Would you like to just tell us about the program that you're doing to educate the the prescribers?
Sure. So as I mentioned, about 2.5 years ago, I came across a study that was done by a Dr. Jill Smith, I believe, in Pennsylvania. Mm-hmm. And what fascinated me was the results that she reported in her study. I believe it was in Crohn's disease.
Yes, it was. Yes.
And we know in conventional pharmacy that they're using very expensive biologics to try and treat that Crohn's disease. And what I saw with the results in her study, which really fascinated me, was she got a huge percentage. I believe it was over 80%, of patients to respond positively with just the low-dose naltrexone. And I believe it was like a 12-week study. She even measured by histology, measured the tissue and documented changes in the tissue in these patients. That study opened my eyes to say, wow, this is evidence that is compelling. And now we have some of these studies, and we attended the Research Trust program in Portland this year to further our education, to learn from the practitioners that are doing the study. And it was phenomenal. That there's so much science and evidence now being reported, and we need more, because it just, as you said, the number of conditions that potentially can be helped by LDN is enormous.
Over 240 that we know of right now. If there is an autoimmune component to that condition, the chances are
Absolutely.
LDN would work, or pain. And as we were saying before, mental health issues, depression, traumatic stress. Unbelievable what these people have been through in their life with all these drugs that make them feel like zombies and so on. How
I have a very dear friend who was in the military for many years and has some form of PTSD. And his primary issue, and he's married a number of children, was severe depression, unfortunately mixed with anger. And he was on 3 different medications and still wasn't doing well and had many breakthroughs. And I suggested that we, after I saw him as a patient, that we start LDN. And after 4 months, his wife called me up and said, my goodness gracious, what are you giving him? And at this point, which is almost probably 9 to 10 months afterwards, he's off 2 of the other medications. We don't just take them off right away. We make sure that they're stable. And we did add some other nutritional elements. And I also put him on methylfolate because he was MTHFR positive, and he is a new man, according to his wife, and that's wonderful to hear. To answer one of your questions of what do we do, Jean is very good about putting together PowerPoint presentations. So we've tried to make it such that our PowerPoint presentations give the doctors in the audience the science behind LDN, and then we give them all the other things where it has worked, and we have personally found it to work. So the presentation is oftentimes more questions than anything else. And we have found that to be a very healthy approach. We also have found that many physicians don't want a lot of PowerPoint slides anymore. They would rather listen to us. So we try to minimize the slides in itself and do more of the oral presentation as to how to use LDN, why does LDN work, the time that's necessary, how to go low and go slow, and the alternatives to add with LDN. Because, again, LDN in itself certainly can work for many patients, but most of the patients require the functional medicine approach.
Well, I feel that 2018 is going to be the year for LDN. It's like a snowball. It's gathering speed as it's going down the mountain and getting bigger. And I think what you were saying about giving talks, how the questions are very important. We always, at the conferences, have an hour's Q&A at the end of the morning and the end of the day. And in the 3 days, we had 5 hours of Q&As. And that is so important that everybody can ask their questions to these panelists, expert prescribers, researchers, scientists, to actually put your questions to the people who really do know the answer is phenomenal.
Yes, I totally agree. I was also at the Portland conference, and the pediatrician there was especially helpful for me with children and of how LDN can be helpful in cases of autism, ADD, and ADHD, so that we can get some of these children off. I have one patient that's at 3 and 4 years old is being placed on an amphetamine, and science has certainly shown that these children who are placed on amphetamine such early in life end up with all sorts of emotional problems later on in life, let alone other things as well. So whatever we can do to help, I'm certainly up for. And I hope that will continue as well, because I found that extremely helpful.
Good. Well, we have even more ideas for the next conference, so you'll have to come back. We're having the 2019 one in Portland again, and the 2018 is going to be in Glasgow. We're fitting another one in between, but it's just going to be a one-day conference.
In Glasgow, Scotland, you mean?
Yes.
It's a beautiful place.
Well, we'd love to see you if you can get over there.
I would love to. I actually love Scotland, and I will say that even though I don't do this office, I do love to visit the distilleries.
Yes, they're very nice whiskey. Well, thank you both very much for joining us today and sharing your experience with us, and we hope that we'll have you on again one day.
Well, thank you, Linda. So appreciate and feel honored to share our story with you, and also thank you for all that you're doing. It's amazing, and we keep up the good work. Thank you.
Yeah, thank you, and God bless.
Thank you. Jean Gresh, compounding pharmacist, and Nicholas Palermo, DO, family physician from Vernon, Connecticut, have created an educational program to educate physicians about the evidence-based benefits of LDN. They are currently following approximately 300 patients with various complex diagnoses. For information, please contact manager@pioneerhealthcenter.com or call Pioneer Health Compounding Pharmacy on 860-979-0089.
Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.